Options they have teased include giving money to Americans to cover healthcare expenses and subsidizing out-of-pocket costs for low-income people enrolled in the ACA. This is the ACA subsidies. That is the subsidy that they just got rid of. It's kind of hard for me to talk about anything else. God, initially I wanted to also talk about the Trump administration considering doing the ACA subsidies again. I guess I'll wrap up with that. So the government shutdown, the longest government shutdown in history happened in the United States. And then we come to find out that it was all for nothing. Your voice got so much softer. Thank you. I've been practicing a lot. I've been voice training. Thank you for noticing. I've been doing feminizing voice exercises. The government shutdown happened recently, right? Trans perhaps? Yes. How did you know? And you know, it was the longest government shutdown in American history, and we find out that it's for nothing because the Democrats just gave up without a fight. You know, and they when did the egg break? A few weeks ago, like maybe at most a month or two ago. Yes, the ACA subsidies, longest government shutdown in history, in American history. Democrats caved for no reason at all, without getting the potentially the most important thing that the negotiations were about, which is a guarantee of the extension of the Affordable Care Act subsidies. For those not familiar with American healthcare, we don't have a healthcare system. What we have is a privatized hospital system in which the only thing that exists for sure is the fact that insurance companies get infinity money per second. And the Affordable Care Act, with the associated subsidies from the government, is the shittiest price control mechanism in the world. Nonetheless, it is still a price control mechanism, and that keeps the cost of such healthcare from exploding even harder than it does by pure necessity of being privatized and run for profit, right? If there are no ACA subsidies, I talked about this a little bit. If there are no subsidies for the Affordable Care Act, it is almost a guarantee that healthcare would pretty immediately become 2 to 4 times as expensive as it is right now. In fact, the average premium increase for Americans would be 114%, over a 2 times increase. And that's just the premiums. That doesn't count quote unquote deductibles and copays, which are amounts that you have to pay out of pocket before your insurance actually pays out anything for you. So in addition to having to pay hundreds of dollars per month, you also have to pay hundreds or thousands of dollars up front before insurance is like, okay, we'll foot the rest of the bill. That is the healthcare system that we have in America. And the ACA is basically, the ACA subsidies are basically the only thing preventing America from any given moment at experiencing a utter and complete healthcare crisis and collapse. I make no exaggeration when I say that if ACA subsidies were gone, the life expectancy would drop 2 to 3 years over the course of 1 year. And there would be record amounts of medically related bankruptcies, medically related debts piling up. People would drop their health care so that for people who still pay for their health insurance, it would get way more expensive. The consequences are so drastically negative that the accelerationist part of my brain started saying, hold up, they might be cooking. You know? But the Republicans actually realized about how disastrous that would be. And so now the Trump administration, having succeeded in getting rid of ACA subsidies, has decided to potentially reinstate those subsidies just under a different name. Eh. All right. Hello, Politico. The White House knows it needs to act on healthcare affordability. Here's what's on the table. Senior Trump administration health officials have been meeting to discuss how to respond to the year-end ACA subsidy expiration. So they've committed. The ACA subsidies are going to expire at the end of the year. There is going to be a period of time where those healthcare costs explode. Trump's Domestic Policy Council and senior health officials have been meeting privately for preliminary conversations on how to address the expiration of health insurance tax credits, because everything in America is a tax credit for no reason at all. Mashallah, may President Zoran destroy the capitalist elites. True. 1 million years socialism with Zoran Mamdani characteristics. Conversations about a White House alternative to Affordable Care Act subsidies, which will expire at year's end, are in the early ideation phase, said a third person familiar with the talks. Like others, these people were granted anonymity to discuss private conversations. Options that administration officials have publicly teased in recent days include giving money directly to Americans to cover health expenses and subsidizing out-of-pocket costs for low-income people enrolled in the ACA. Global Islamist Marxist jihad. That's true. Truly a Trotsky moment. Socialism in all countries, actually. Thank you. So, options they have teased include giving money to Americans to cover healthcare expenses and subsidizing out-of-pocket costs for low-income people enrolled in the ACA. This is the ACA subsidies. What they are talking about right here, direct payments and subsidies for low-income people with their health insurance payments, that is the subsidy that they just got rid of. They're saying, fuck, we actually need to bring this back. The push to address rising healthcare costs comes as Republicans stare down promised December vote in the Senate on whether to extend enhance Obamacare subsidies. In their absence, Americans are expected to face an average 114% increase in insurance costs in 2026, according to the nonpartisan health research group KFF. Let me guess, this is the Koch Family Foundation. Public stuff with extra steps. It's 1 million times more expensive, but kind of. This is actually not. This is literally socialism for the rich. The government is subsidizing the control over healthcare for the private sector. These subsidies, a lot of the subsidies were paid on the insurance provider side of things. The ACA subsidies, the reason I call it the shittiest price control known to man is that the subsidy wasn't the government giving you money to cover your costs. It wasn't the government covering the costs itself. It wasn't you get insurance or healthcare through the government, they foot the bill, and so you don't get charged anything. No. It was the government asking insurance companies to pretty please not charge more than $400 a month or $800 a month for whatever healthcare plan. And in exchange, we'll foot the bill, but you still also get to bill people who need their healthcare. It was actually like partly the worst of all possible worlds. But again, even the shittiest possible price control is still a price control, you know? Where single payer systems are like the partial nationalization of the health sector with the government footing the bill entirely for all private insurance plans and ensuring that any bill that the consumer or like a patient receives reads a big fat zero. That is normal single payer health insurance where there is a public health sector. You don't pay anything out of pocket. The government foots the bill and they negotiate behind the scenes with private health providers to ensure that they're not charging the government so much that it's like unsustainable, right? That's what that normally looks like. You know, that's a typical like social democratic thing. What America does is, yeah, the government negotiates, but guys, there's no such thing as a public hospital anymore in America. There are no, like, the health situation in America is so dire. The only public ambulances that exist are the fire department. The fire department has ambulances because ambulances that come from the hospitals are private. They're owned by a private company. It is not free to ride in an ambulance from and to a hospital in America. That's why people call, when somebody falls down, you don't call the hospital, you call the fire department. That's funded and free at the point of service. You know, the health sector, that's so heavily subsidized. Every iota of healthcare that every American receives has already been paid for 2 or 3 times over out of pocket, and that's before the insurance company hands you the bill. And believe me when I say they hand you a fat bill, even with the ACA subsidies. But that's still more stable than having no subsidy or price control at all. You know, this basically they've realized that this would be such a crisis that it would actually jeopardize the bottom line of these insurance companies. So they've said, fuck, we actually have to keep this thing going so that the insurance providers and healthcare providers have a stable bottom line, because otherwise they're fucked too. All eyes on the midterms. Yeah, legitimately, they've realized like it looks electorally horrible for them. They're considering whether this would affect them in the upcoming election. So they're like, maybe let's not destroy whatever's left of, you know, like whatever the fuck passes for a health system in America as like our main legislative act this year. Because reminder, this is one of the only major things that has happened in the government this year. Like the only major bills or laws that have been passed, you know, that has made news. Everything else has made news because of how far outside of the conventional like framework of passing things through Congress it is. The acute political challenge brewing for the White House has echoes of the 2018 midterms when Democrats successfully capitalized on the unpopularity of GOP efforts to repeal and replace Obamacare. It's always healthcare that the Republicans fucking shoot themselves over. White House officials and Republican lawmakers are cognizant of this vulnerability and are looking to coalesce around a plan for the future of the healthcare system. I think the White House understands one of the sub-issues of 2018 was that the Democrats used against the Republicans was that we were going to take away their Obamacare. That's a non-starter now, said a person close to the White House. Now you can't get rid of it. What you're wanting to try to do is fix it. See, they've had to shift. Guys, the healthcare situation in America was so dire prior to the Affordable Care Act that now Republicans can't even campaign on getting rid of it because the consequences of that would be so disastrous that it would kill their entire political coalition. Literally and figuratively, by the way, because the political coalition of the Republicans relies a lot on the support of rural, low-income people who would otherwise live in medical deserts where healthcare is even more prohibitively expensive. America, please just do Keynesianism. Oh, we do Keynesianism. It's just the worst possible type of Keynesianism. We do neo-Keynesianism. But yes, you know, some real 20th century Keynesian patriot shit. Yeah, Keynesian socialism would go hard right now. I would very much like that. You know. Trump has repeatedly suggested that he wants to repair Obamacare, but hasn't publicly ruled out a straightforward extension of the ACA subsidies. He hasn't taken a firm position as the administration sorts through policy proposals, a senior official said. Trump has a specific vendetta against Obama, which is why he wants to get rid of Obamacare. Which ACA and Obamacare, this is just the nickname for the Affordable Care Act. Obamacare. Depending on whether the news media wants to embolden the Republicans or like, if they want to lend credence to the Republican narrative, they'll call it Obamacare. If they want to like properly convey how disastrous the consequences of destroying the American health system would be, they call it the ACA. So, like, they'll only ever call it Obamacare because association with the only black president America's ever had, to activate the racism gene that's like fucking Metal Gear encoded into Americans or something. Republicans in Congress have put forward different versions of redirecting the Affordable Care Act subsidy money into federally funded accounts for Americans. Some Republicans support. This would actually, unironically, this might actually be an improvement. Having federally funded healthcare expense accounts. Yeah, the fucking Red Scare sleeper agent shit, like your activation code word. Some Republicans support depositing funds into health savings accounts, which can be used more broadly on expenses and roll over year to year, while others would opt for flexible savings accounts, which expire at the end of the year and are narrower. This is more like, okay, this gets into more like neoliberal fiddling around the margins, $25,000 credit for first-time home buyers type shit that does nothing for nobody. Because at the end of the day, the fascists are also just neolibs. Of course, he backs the most direct one because he could put his name on the dollar amount, be like, haha, Trump did this, or whatever. Other options include giving federal dollars to insurance companies to reduce cost sharing, like deductibles and copays. This is literally what the ACA subsidy is, and they still do deductibles and copays. Which, by the way, deductibles and copays are the same thing. It's money that you have to pay out of pocket. They just invented two of them so that you have to pay more out of pocket. The only difference is that you have to pay the copay up front, and then hit the microphone again. I keep doing that. You have to pay the copay up front. So before they administer care to you, you pay the copay, right? Then they administer care, and then because there's a fucking surprise billing in America, or there's like a zero transparency with respect to medical care, you only get the bill after they have administered the medical care, until after you've signed the contract or whatever. Like, oh no, I broke my arm, I have to go to the hospital. They put you in a cast, they take pretty good care of you. Then they're like, all right, great, stay at home for however long, make sure to not put any pressure on it, whatever, just let it heal. Then they give you the bill. They only give you the bill after already administering the care that they're charging you for. It's literally an insurance racketeering scam. That's our entire healthcare system. And the relevance of that, again, to deductibles and copays you pay before, deductibles are part of that bill. In your medical bill that they give you after the fact, at that point, you've already paid the copay. Then the deductible is the amount that you have to pay them before insurance pays them. And sometimes the insurance doesn't even pay them. They just say no. Anyways, the point of this is that the Republicans realize that them trying to obliterate I hate America, who amongst us, me too, death to America moment. The Republicans have realized that they are the dog that caught the car yet again. They have been trying to destroy Obamacare bit by bit for years. And now that they've finally done it, they realize that it is like the tiniest bit of tape and wires preventing America from falling apart at the seams and becoming the world's fourth world country next to Argentina. So they realize, shit, fuck. We have to put all these tape and wires back to make sure it doesn't like collapse as hard as it would but like, I don't know, maybe write our name on the tape and wires. Sure, that'll be good. You know, so it went from like them trying to actually get rid of it to them now probably just trying a rebrand. But it does make the accelerationist in my head a little bit sad, because now this still inherently unsustainable healthcare system is going to persist for a little bit longer. Which is unfortunate.
Thanks for watching, and support the channel if you would be so kind.